Hi, this is Dee. This is a podcast from Balance, Living, and Unfiltered. And today we are going to talk about shrinking fibroids naturally. And I also want to introduce the doctor on the call today. Well, excuse me, the podcast today. Thank you. And again, my name is Dee. I am the virtual office manager here for Balance and Birch. And I just want to share how I have been a client as well. I had as far as a journey through um, fibroids, and it was as far as a process that I started as far as the unknown. So I outreached to our team, of course, to see if there was a way for me to get help, and I wanted to try, of course, the natural way. Um, so as I refer to her as, of course, and she was able to help me through the journey. And I just wanted to highlight her because I want to share that she offers as far as a service for everyone and for people on the team. And I was able to benefit from it. And this was as far as a hard time for me. Never had as far as an issue before in life when it comes, to health. And I really wanted to spotlight this as there may be some other people out there that are struggling, not for sure of what to do and how to do. So first, I do want to say I thank you for as far as the process, and this has been going on, I believe, in mm, I want to say, yeah, about 2 years. hmm Um, and I was able to outreach the end. I started up an appointment, same, as far as process with your intake, and was able to review my history. And it just has been a nice time, and also as far as experience, even though I was in as far as a place of being stuck, when it comes, the fibroids. And I just want to stop there and see if you can provide some highlights of what it is to have the fibroids. And I, of course, can piggyback off that of what I went through. Yes, and I agree with that, and thank you for highlighting that too. Right before I came to you, I did actually see two other providers, and all I heard was birth control and possibly a hysterectomy if it gets to where I can't actually manage anymore. And at that time, I was about 36, about to be 37. And I'm 39 now. And I was like, well, I don't have any plans to have any more kids, but I don't want a hysterectomy though. So that's where I was kind of stuck at that point because I went to other people. They shared, of course, their life experiences, and a lot of people have actually had hysterectomies, and then they have a lot of problems even afterwards. Some people do, and some people don't. I just didn't want to have surgery. I was just like, I don't want a hysterectomy. Why can't we fix it? Why can't I just it was just why, the unknown. I felt like it was unfair. I've only had one child. Why am I going through all this? And of course, when I came to you, I was frustrated. I had some lab work done. We noticed my vitamin D level was low. So I know that you started me on a regimen with that. Immediately, I started to feel a little bit better with as far as my energy level. Still struggling with as far as the issues, of course, with the fibroids, but I know you had gave as far as a diet plan, lifestyle change, just being able to work out, planning a lot better, working on my stress level. That was a lot of the things I had to work on me. And you were very helpful with that. Um, I feel again that this is just, a topic. It's either a hysterectomy or birth control, or people just don't do anything. And thank goodness I was fortunate enough to have the insurance, money, and different things to be able to navigate through the system and having a little bit of the understanding in healthcare. But I really feel for people that don't have the understanding or not for sure of what to ask. Um, I think too, and a lot of the times I would probably seem a little frustrated, or I think I had a lot of unrealistic expectations too. Um, and fast forward to now, I'm glad I was patient. Um, I feel a lot better. Um, and to know that there is a natural way, and a hysterectomy does not have to be well, I'm sorry, it didn't have to be as far as the answer for me. Um, and that's what I was thankful for with you. Um, you open my eyes to more of just as far as options for that. You did. You really did. Hmm. 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 And I thank you for that too, because I know when I went the first time to a provider, they said, oh, well, maybe you're stressed out. I'm like, but how do I go from having a normal cycle to controllable for 30 days of a cycle. That's, I mean, that's not normal. I've had a cycle, for years, and it was just, oh, well, maybe you're stressed. Well, do you want to take any lab work, well, can we do something else? It was always, oh, I just kind of felt like it was just as far as a band aid, was placed on it. And I just feel as though women's health, a lot of the times, I feel there's not enough out there. And I feel I can just speak for me. I feel a lot of the times I was dismissed as, oh, it's just a bad cycle month. No, this has been going on for 6 months plus. This is not my norm. I'm telling you, it's not my norm. Um, I was glad I was able to say, no, that is not the final answer. And I'm glad I reached out to our team to help. I'm glad we have this here to help people. That's what made me really frustrated, because I thought about other people. What if they're struggling out there and don't have the team like I have to fall back on for help? And it makes me kind of sad, because I know there's a lot of women out there suffering and don't know why. And they might even be scared to do it, or they may actually put their health on the back burner, so to speak, so that they can take care of their family and children. And I think that's what happens to a lot of women. Whether you have kids or not, you may just be putting things ahead of you instead of saying, okay, this is not normal. This has been going on for a long time. I need to see about this. So I feel, mhm. It's really, really frustrating, because even when I research a lot of stuff, it just doesn't have a final answer. It's unknown, or they go back to, you're just having a bad month of a cycle. But nobody should have to suffer in pain like that, I feel. Why? I mean, that's not fair. Um, yeah, it's just not fair. And I'm frustrated about that part still. Um, it just needs to be more research done on this, on fibroids. And I feel that there needs to be an easier way to get healthy foods too. Because when I did a lifestyle change, I really seen how hard it was to eat healthy, how much further I have to drive, how much I have to do just to find those healthy foods. And as a kid, I grew up in a southern area. It was easy to get, the farmland. It was easy to get those foods. But if you stay in a city area, it may be harder to get, or they may only have certain things that are there and readily. But mhm, 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 mhm. Mhm, 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 mhm. So true, so true. And I just had to learn over time, it's best that you have to speak up, And even if you don't know what to say, write it down. Write down how you're feeling on your cycle, or this is day number 14 for you or 20 and you're feeling bad, and you can actually take that in onto your doctor's office and say, hey, look, I'm not for sure of how to go about this or where to go about this, but this is how I feel on this day. And that can actually open up and paint, of course, a picture for them to say, okay, she's been struggling with this for 3 or 4 months, and this is how, she feels. And I think that would help, to paint a picture and provide them with history, and I just think some people, they just don't know what to say or how to say it, or it may be the fear of you going into a hospital or a clinic and you don't know, or some people may feel that you're going to pass judgment on them. It could be all sorts of things. I'm just trying to think of ways and taking myself out of, just being in healthcare. How would I possibly feel? So I hope that this will help somebody to open up and ask some questions. And even if it's on the outside of having fibroid problems, or just, for health issues in general, learning how to speak up and how, to advocate for yourself. You don't have to take what one person says as a final answer, and you are responsible for you and your health, and that's what I've learned over time with this, because I went from being perfectly fine from what I thought to having all these health issues and all these different problems leading from fibroids, and being so tired I can't even work a full day. I'm only good for 4 hours of a day. That wasn't normal for me because I used to work 7 to 7, a 12-hour shift. So if I didn't have a work at home job or anything flexible, would I have even been able to keep my job? You know? So it makes you really think. But I just want to say thank you. And I can speak from a personal experience of working with you that you have been phenomenal. And I'm so happy and always look forward to give you as far as the updates of my. Sure. Hmm. Mhm. Thank you, and I really do appreciate it. And I hope again this helps someone or just learn from it. But yeah, I just want to say thank you, and I'm sure we'll do some follow up things on this. But yeah, thank you so much. Have a good day.